A missing tooth happens whenever you have a tooth extracted, or in some rare cases, whenever the tooth didn't develop in the first place. In the case of when a tooth is extracted, it's because there's been a lot of decay or trauma or gum disease to that tooth and it has been removed. Once the tooth is removed, there is a gap. The teeth behind the tooth that was extracted, or behind where the gap now is, will fall forward and will be less vertical than they were previously and become more horizontal. That will have an effect on the gum disease of the tooth that's falling forward, because it's harder for you to clean a slightly horizontal tooth than it is a vertical tooth. The other thing that will happen is the tooth opposing the gap will over-erupt. What that means is it will come out of the socket and grow slightly down into the space where the gap is. Again, this will complicate your occlusion, complicate the way your teeth bite or come together, and it will compromise the teeth on either side of this over-erupted tooth. The other thing with a missing tooth, there will be less teeth to bite with, and therefore the remaining teeth will have more work to do individually, and therefore will come under more trauma. Generally, if you have a missing tooth, it is either because of gum disease or dental decay in the past. Gum disease more than likely has not just affected that tooth, it will affect other teeth, and therefore you need to have an overall plan to contain the amount of teeth that you may lose in the future. If the tooth has been taken out because of decay, more than likely other teeth are decayed, and you need to have an overall plan to maintain the remaining teeth. If you have a tooth that has been taken out and you have a gap, generally at the front of your mouth, aesthetically it will not be acceptable, and people don't want to walk around with a space at the front of their mouth. Options to replace this tooth would be: one, have a denture, a little plastic denture that will fill in the space and it will suffice. However, from a biting point of view, a denture will not give an awful lot of pressure to your bite, and over a period of time, realistically, it will not give any function to your bite. Other dentures, like a chrome denture that hooks around the back teeth, will give a little bit more function, but over a period of time, again, function will be decreased. You can put around about 20% force on a denture that you can on a natural tooth. So as you can see, the amount of force that you can put on a denture is very limited. The other two ways of replacing a missing tooth is: one, put an implant in. What an implant is basically a screw that goes into your jaw. In the same way as you want to hang a picture on your wall, put a screw in, hang the picture off it. In your mouth, put a screw in, hang a crown off it. Same principle, except it's in your mouth as opposed to hanging a picture on your wall. The third way of replacing a missing tooth is by putting a bridge in. What a bridge is where you put a crown on the teeth on either side of the gap, and then have a crown between these two crowns floating in mid-air. For example, if you have a missing tooth here, you have a tooth here and a tooth here. So what you can do is drill down this tooth, drill down this tooth. In this demonstration, there's been a lot of drilling, a little bit too much, but you can drill down these two teeth into little stubs like that, and you put a bridge on. The bridge has a crown here, and this floating crown in the middle, attached to these two. The advantage of the bridge is it is predictable, but it is destructive to the teeth on either side. If the teeth on either side have big fillings in them already, a bridge is a very good way to allowing you to protect the teeth on either side and filling in the space. Reason for that is any tooth that has a filling in it will need a bigger filling and potentially will need a crown at a later stage. This way you can kill two birds with one stone, put the crowns on the heavily filled teeth and put a bridge between the two. Basically what happens with an implant is you put a screw between the two teeth into the space or where the gap is where the tooth was removed. You have a natural tooth here, a natural tooth here, and you have this screw bedded into your bone. Implants have really come on a lot in the last 10 years, whereas beforehand they were just a screw, not proactive, but now the implants are proactive, bone seeking, and they are an awful lot more secure, stable and long lasting than they ever were. Once the implant integrates with the bone, which normally takes about 8 weeks, you put on an abutment onto the implant and a crown onto that abutment. Sometimes the abutment and the crown will come together and screw everything together, but that is the other way of replacing a missing tooth. Implant, crown, bridge, or indeed a denture. If you are missing one, two, or a number of teeth, make an appointment, have a consultation, no obligation. We can go through your options and discuss what is the best for you. If you'd like to make an appointment at Gallagher Dental, you can do so by phoning us on 01 678 8158. Alternatively, email us at info@gadental.com, or you can visit our website and book online. The website address is www.gaadental.com. We look forward to having you as a patient, and we'd love to see you and hopefully have a long and rewarding relationship with you.